Hey guys, we're here today with Mr. Speakerman. Dave's about what, 6'9"?
6'9".
6'9". Looks like he should have played football for a few years, but Dave actually drove truck for a long time, and he's developed some lower back pain, he's developed some leg pain, and bottom of your foot pain, right?
Correct.
Okay, he's been treating for a few weeks now. I just want to kind of go over what he has going on, and then we'll... So looking here, these are Dave's x-rays, and you can see Dave's got a pretty bad spondylo right here between L4 and L5, and what that means is that he's actually had a slippage forward of one of his vertebrae over the other vertebra. And after reviewing his MRI, we've actually come to notice that the nerves that are coming out of this IVF right here, or intervertebral foramen, are actually getting pinched off, and that's the main cause of his foot numbness. So now I want to show you a little bit about what we're doing for his adjustments to try to help out with this. So when we're feeling Dave's back here, what we're feeling for is basically taut and tender muscle fibers, and trying to feel for if he's having any muscle spasms or anything that's unnatural or more one-sided or unilateral, if you will. And basically we're looking at his feet to make sure that his pelvis and his legs are lined up, because when you get the spasms in the back, it will actually make one of his legs appear differently in length when he's laying down and he's not weight bearing. Give me a nice big deep breath here. Let the shoulders down as much as you can. He's a bigger guy, it takes a little more oomph sometimes.
I can feel it move though.
Okay, so now we're actually going to move Dave's lower back, and like I said before in his x-rays, Dave has a spondylolisthesis between L4 and L5, so we have to be very careful when we go to adjust Dave's back that we don't put any back to front pressure into L4. So what we're actually going to do is, if you want to bring this over this way, we're going to come down and we're going to put that on Dave right here at L5, okay, which this is L5 spinous. What we're actually going to do is we're going to kind of roll him around. And it moves just like that. And Dave will tell you, it doesn't actually hurt. It actually feels pretty good when that moves like that.
It does. You can feel it move, and it does feel good.
So now we're going to go switch Dave over and hook him up to decompression and try to get more of an axial decompression of that disc and try to take some of the pressure off those nerves that are affecting his feet. Okay, now we got Dave strapped all in here to decompression, and basically what we're going to do with decompression is we're going to have a machine here that's computerized that is basically going to, over the next half hour, stretch out his lower back and hold it, stretch for a minute, and then let it back down for 30 seconds, and do that back and forth to basically create a decompressive force right around the area in his back that's compressing those nerves. So I'm going to bring Dave down here now. Now we got Dave all hooked up, so he's going to lay here for the next half an hour and take a load off, and we'll see him when he's done. Okay, Dave just finished up here on the decompression table, about hit his head on it, time to get off, but he'll tell you that you sore it all.
No.
And what we're working on here is, like I said before, we're trying to take the pressure off of that L4 disc so we can take the pressure off the nerves and he can start feeling his feet a little bit better. But this isn't something that happens in one treatment, it takes us a little bit of time, so we're actually going to see Dave back towards the end of the week, and we're going to get him back to the same sort of manipulation that you just saw in this video, and we're going to keep at it until he gets better. So, thanks a lot.
Great. Thank you.